Let's take a look at some areas of healthcare where we have already made some adjustments and improvements in our health. Look at the advancement we've made in tooth decay. We used to have many more cavities and loss of teeth in years past than we do now. We take so much better care of our teeth now with all kinds of preventive care measures. And now our teeth last longer and cause us less pain. More and more people are also living with less wrinkles. That's right, there's about 465% increase in the number of people wanting to get rid of their wrinkles just since 1997. Wow, 12 million people had cosmetic adjustments last year just to get rid of their other ramification of getting older. Now I am for all of us having longer lasting teeth and less wrinkles. But I think all of us can agree if you can't move, a lack of mobility will make you look a lot older than crow's feet. The only reason we respond to our teeth and our wrinkles before our spine is because the simple fact that if our spine moves on our face, we take better care of it. You no longer wait till your teeth fall out before you decide to maintain them, and you shouldn't wait until your back goes out before you start taking care of it either. You take preventive steps to have pearly whites. Take preventive steps to have good mobility, since the chances are absolutely huge that you will live for 30 to 40 years past the age of 50. Why is this even more important than your teeth? Because there's no such thing as a spine transplant. You can get a new set of teeth and other organs, but if you don't take care of your spine, there's no going back like you can with teeth. There's no crowns, no replacement. You just live with the pain. And don't forget, this isn't limited to back pain. And you can't get a new neck either. 1 in 3 people suffer today with neck pain past the age of 50. Let's see a raising of hands here. How many of you would like to use your neck past the age of 50? Yeah? If 1 in 3 have bad neck pain and 85 out of 100 have back pain, that's a pretty high statistics, as I would think anyone would want to see to be convinced that we need to do something preventive about this. Just in case we need just a little bit more convincing, let's look at what will happen if you let nature take its course. As you see here, there's mobility percentage up there, and your age here, you max out at 23, and you reach half of your mobility percentage at age 50, and after that, it kind of goes downhill. Can the scale be changed, or do we just accept the way that it is? The good news is, with preventative care, we can make a big improvement in the line of the scale. If you take a look, same scale again, but this is if you start chiropractic care at 40, extend your mobility percentage out at 75, all the way out to 80, which is what you want, isn't it?
So that's, like I said, that's the bad thing for.
Well, one answer you may be thinking is that this is a perfect thing to do when you're young. But what about those of us who have already experiencing pain? What if we're already past 50? Is it too late to start? Absolutely not. In fact, I want to congratulate you on getting here now. It's never too late to do the right thing. We want to get you on track for a great life ahead, and here's how we can do it. The first thing you need to do is follow through with the whole recommendation of care. The reason I mentioned following through is because you've already lived a long time with the mentality that you only take care of your spine when it's in pain. This means it is going to be easy for you to think that you need to get out of pain. You no longer need treatment. Listen, if you drop out after pain relief, you're never going to change that scale for you. Pain is always the last to show and the first to go. The only way you can change that scale is to follow through with all 3 phases that your recommendation of care. Phase 1 is pain relief.
Yes, sir, you do.
The cause of your pain and other related health problems is subluxation. The misalignment of the vertebrae is causing nerve interference. It is pinching that nerve, which can impact many areas and organs of the body, causing a lot of disease in ways that you would not relate to back pain. Now let's think of this as an example. If you have a garden hose and you hook it up and the water flows perfectly, but if there's a kink in it, then it doesn't flow. Well, if you look at this as your back, In other words, the misalignment of your spine is causing nerve interference or is stopping the flow of the message from the nerve to the other organs or body parts, causing you back pain and a lot of physical ailments due to the nerve interference. When the nerve interference is removed, that nerve flow is restored, and so is your health. So how do we remove the nerve interference? Through a series of adjustments.
I don't know if she will do it or not.
The adjustments will gradually move your spine back in alignment, away from that nerve, allowing your body to heal itself. You say, great, I get a series of adjustments that removes that interference, getting rid of this pain and the problem. So why can't it just stop after the pain is gone? It is important to emphasize this is the only the first phase of your care, and this alone will never solve your problem or change your mobility scale. We must proceed to phase 2 of care, which is stabilization of care. There is a reason why you must not stop with your care after you get out of pain. Your spine has actually been misaligned for a long period of time, and your body has now accepted that as being correct. Your body actually thinks that this is the way it's supposed to be because it has been this way for so long. Now the body and muscles and spine must be retrained. The spine and joints must remain in proper position for a long enough time for the body to accept that proper alignment as a norm. This is called stabilization, and this takes time. Unless the spine and joints are retrained with adjustments, your body will naturally go back to the way it was. Why does it take work and time? Well, as an example, can you go to the gym for the first time and be in shape? Of course not. We all wish we could go to the gym for the first time and be in shape, but it takes a lot of time and a lot of work. To get your musculoskeletal system stabilized, it's going to take a number of treatments, and you need all of them. Did the orthodontist straighten your teeth on the first visit? Of course not. It took a very long time. Once your teeth were straight, you kept your braces on for a long time, and then once you got them off, you started your retainer and wore that for even longer. In the same way, I've given you a recommendation of care that will not only get you out of pain, but it must follow so that you can get stabilized condition, meaning your body has accept healthy proper alignment as a norm for your body. Once you reach the stabilized condition, we will dismiss you from active care and recommend a preventative health care plan. This is where we enable you to change that mobility scale and make a difference in the quality of your life. It isn't enough for us to want to get out of pain. We want you to move to an opportunity where you can enjoy life. The good news is the stage does not require a lot of money or a lot of time. It will be simple and affordable, but also essential to changing that mobility scale for you. Even as I'm talking, I can hear thoughts running through your mind saying, I knew it, I always heard chiropractors want you back for the rest of your life. Well, maybe you're right, but before you make any judgments, let me ask you a question. What doctor have you ever been to that said never come back again? Do you go to the dentist for the first time?
What time works best for you?
When they say don't come back until your teeth fall out, he or she wouldn't say that because that would just be malpractice.
First thing in the morning.
They push you to do the right thing, which is preventative care. I think it's time for us to be honest. There isn't any doctor who has or should recommend you to ignore your health until there is a problem.
Okay.
No doctor could recommend that you never come back, and we certainly can't either because it wouldn't be what you need to enjoy life. Be assured we don't want you to come in any more times than you have to. The purpose of a recommendation is to change that mobility skill for you. We can't remove your wrinkles or make your teeth stay white, but we can enable you to move, to work, to play, and stay young for the first 100 years. This is one of the best investments that you can make. We must be able to move. To illustrate how sincere we are about preventive care, Doc gives out a gift that you can give to others. It's free consultation, report of findings, and x-rays are included with that. Just get with Kim and she can schedule them today and they can move that around to however they would like. Thanks for watching.